My name is Srikumaran. I'm an orthopedic surgeon with Johns Hopkins and Howard County General Hospital. I specialize in shoulder surgery. A fracture involving your shoulder usually involves a significant trauma, such as falling onto your outstretched arm or maybe being involved in a car accident. These injuries are extremely painful and can limit your function immediately after the injury and can be confirmed with an X-ray. If you're diagnosed with a fracture by an emergency room or an urgent care center, you should see an orthopedic specialist as soon as possible so the appropriate treatment can be started in a timely fashion. Some fractures may only require a sling and physical therapy, while others may require surgical intervention. Fractures can involve different portions of the shoulder. Fractures can involve the proximal part of your arm, or the proximal humerus, or can involve the socket of the shoulder, also called the glenoid. Fractures can also vary in severity. Some are simple breaks where the two bone pieces do not move relative to each other. These are called minimally displaced or non-displaced fractures. Other fractures can be more severe and the bone can be broken into several pieces. To ensure the best possible recovery after a shoulder fracture, you should see an orthopedic specialist to be evaluated. They will perform a physical examination and order the necessary imaging studies to confirm the diagnosis and determine the fracture severity. After a diagnosis has been made, you can have a discussion with your orthopedic surgeon regarding treatment options and discuss the relative risks and benefits of each approach. The surgical repair for a shoulder fracture involves an open surgery, generally under general anesthesia, also with a nerve block. The surgery is an open surgery and is a 10 to 12 centimeter incision in the front of your shoulder. The pieces of bone are carefully realigned and fixed with a metal plate and screws. In some cases, the fracture may be so severe or the bone quality so poor that the metal fixation cannot hold. In these cases, a metal prosthesis will be used to reconstruct the shoulder. Recovery from surgery for a shoulder fracture involves a 1 to 2 day hospital admission followed by outpatient physical therapy. Depending on the type of surgery you've had, physical therapy will start with gentle range of motion exercises initially performed by the therapist or passive range of motion, followed by active range of motion exercises performed by the patient. When range of motion is restored, strengthening exercises will begin. And this typically occurs after the bone has healed in 3 to 4 months.